Alright, today I'm going to be showing a tibialis anterior taping technique with Kinesiotape that we used for one of our patients with foot drop. She also had plantar flexor spasticity, so this was kind of a way to try to work on keeping the anterior tibialis activated when we weren't in therapy and use it as kind of a way to reiterate the need for a little bit more of that dorsiflexion during gait away from physical therapy. So what I'm going to do first is I'm looking to start with my anchor point kind of in the proximal aspect of the muscle belly of anterior tibialis. So I'm going to be a little bit anteromedial to the fibular head right here. I'm going to come down, around following the muscle belly, come over the tendon, and for this one I'm going to go under the foot and attach my second anchor right above the cuboid on the lateral aspect of the foot right here, just because we found that it helps kind of keep the tape stuck a little bit better and prevent a lot of the rolling off and give us a little bit more time before the tape has to be reapplied. So I'm going to start with my anchor here. And it's really important to get your angle right at the start here so that you're not causing any curves right off the bat. So get my anchor point stuck right there. Then I'm just going to peel some of the paper down. So for this one, we're not looking to kind of get any specific amount of stretch since it's really hard to be consistent with 50 or 80% stretch. So what we're going to do is just work our patient into as much dorsiflexion as they can actively get. And then we're just going to keep them there while we're doing the tape, and then kind of use just their natural plantar or tendency to go into plantar flexion to kind of give them that stretch. So I'm following the muscle belly down and around. Down under the foot, trying not to get too distal, coming down under, and then looking for my anchor point right here around the cuboid. So from there, we're going to look to lay it down as flat as possible, trying to keep any wrinkles out. Then since the adhesive is heat activated, we're just going to give a little bit of friction, get it to stick a little bit better. So we're getting the dorsiflexion from the anterior tibialis and also a little bit of that inversion that we get with it as well. So working on both actions there. And we found that this taping technique was able to keep on the patient for 3 to 4 days. So we generally made it between sessions pretty well. So I'm going to give you a view from both sides. So here we have the lateral anchor point, sorry. Come down and around following that muscle belly.